age, although something to consider obviously in somebody's medical history, there's no age limit to which you can get breast implants. So it really just depends what the goals are and what the anatomy is, right? So if someone's anatomy is such that they've had a couple of children, they've got like sagging breasts, there might be some different types of operations that are presented, but otherwise it's really age agnostic for getting, wouldn't you say?
I would agree, yeah. A lot of it comes down to the medical history. So are you healthy? We get a medical workup and medical clearance for our patients. And so really it doesn't come down to age as much as are you healthy to have surgery? Most patients are. It's a minimal risk surgery, outpatient, takes about an hour. And so really it comes down to the medical history more so than the age itself. But there are some considerations, as Dr. Blackman was mentioning, in terms of like where you are in your life. So if you're planning a pregnancy in the next year, for example, it may not be the best time to get a breast augmentation or a breast lift, for example, because there will be anatomic changes to the breast shape. So
yeah, if you're planning on getting pregnant, you should wait until after you're pregnant, or well, after you've delivered, after you've breastfed, and then even give it another 6 months till you stabilize, because otherwise it's just way too many changes happening.
That's right.
It's not going to make any sense with the implants in at that time.
Of course, the breasts will get bigger, they'll engorge, and then there will be a deflation after breastfeeding, and you want to wait for that weight stabilization. Or if there's a radical change in weight, if there's a significant weight loss or a significant weight gain, especially over a short period of time, you want to give yourself some time to allow those skin, breast parenchymal changes to occur.
It brings up a good point, because nowadays there's a lot of patients on Ozempic or drugs like that. So patients are having radical shifts in their weight, and it would be a best practice to get to a stable weight and be at that stable weight for probably about 6 months to make sure that you can maintain it before having any kind of breast augmentation procedure, because the last thing you want to do is put breast implants in someone's body that's changing, because it's kind of like trying to hit a moving target.
That's right.
So you don't want to end up in the operating room again for some kind of nip tuck because we misjudged where your body is at that point in time.
That's right. And we take a very detailed medical history for all patients. So that includes your breast history, if you have lumps, bumps, masses, what your family history of breast cancer is. At a certain age also, you may need a screening mammogram. For very dense breasts, you may need an ultrasound or some other imaging modality, especially if there's a concern. And so we take those into consideration as well. And so that can be a little bit of an age-specific variation in terms of planning for breast augmentation.
So if you're considering surgery, make sure you're working with someone who listens, educates, has experience, helps make the best choices for you. Call us at 212-427-3982 or visit breastsurgerygroup.com to schedule your consultation.